Assalamualaikum warahmatullahi wabarakatuh. Welcome audience to our video. In this video, we're gonna tell you about tooth decay and we're going to introduce ourselves.
My name is Roy Saputra Wirawijaya.
My name is Muhammad Rizko Widiatna.
My name is Farizal Akbar.
My name is Muhammad Afin Al-Farisi.
My name is Hanifah Radila.
My name is Ronawati Anugrah Lagoseki.
And enjoy the video.
Tooth decay can be also called cavities, are usually called as a permanent damage area in the hard surface of the teeth, or we can call it as a tooth enamel that develop into a tiny opening or hole that might caused by several factors such as the consumption of sugar, the time period, and then bacteria and the shape of the teeth. Tooth decay are among the world's most common health problem, and especially common in children, teenagers, and older adults. But anyone still can get cavities, including infants. Today, tooth decay can also occur in variety degrees of severity. The damage from tooth decay can be ranged from causing wear to the enamel to the painful abscess within the pulp of the tooth.
So you already know about the definition of tooth decay. Now you may wonder what can cause them. And some risk factors are like tooth location, because decay most often occurs in your back teeth, such as molars and premolars, because they are really hard to keep it clean than the front teeth. And then certain foods and drinks, such as milk, ice cream, honey, sugar, soda, dried fruit, cake, cookies, hard candy and mints, dry cereal and chips. And also frequent snacking or sipping, bedtime infant feeding, inadequate brushing that can cause plaque forms quickly, and the first stage of decay can begin. Not getting enough fluoride, use of medication that can reduce saliva flow, dry mouth, warm fillings or dental devices, heat burn, or gastroesophageal reflux disease that can cause stomach acid flow into your mouth, and this can expose us more of the dentin attacked by bacteria, creating tooth decay. And last but not least is eating disorder, where eating disorder can also interfere with saliva production.
Complication. The decay can have serious consequences on teeth and overall health. It can cause the following. First, sudden and sustained pain or sometimes violent in the teeth and jaw. Second, abscess, sometimes accompanied by fever and swelling of the face. Third, bad breath. Fourth, loss of the decayed tooth. Fifth, difficulty chewing food. And sixth, difficulty with pronunciation. The decay can also affect appearance, self-esteem, and well-being. Also, untreated cavities can lead to costly care, especially if a tooth that is impossible to keep must be removed and replaced. For children, pain caused by a cavity can lead to various complications in children, including first, difficulty eating, which can lead to stunt growth. Second, sleep problem. Third, concentration problem. And fourth, anxiety, a tendency of getting angry easily and fatigue. The child may also appear depressed. An infection caused by tooth decay may require the extraction of one or more teeth. This may impact pronunciation, appearance, self-esteem, and overall well-being, in addition to being the cause of school absenteeism. In more complicated case, tooth decay should be treated under general anesthesia at the hospital.
So actually, we are able to prevent tooth decay. Here are some tips to help prevent cavity or tooth decay. Ask your dentist which tips are best for you. Okay. The first tips is brush with fluoride toothpaste after eating or drinking. Brush your teeth. Brush your teeth at least twice a day and ideally meal. After every meal. Using fluoride-containing toothpaste to clean between your teeth. Floss or use an interdental cleaner every night. Second, rinse your mouth if your dentist feels you have a high risk of developing cavities. He or she may recommend that you use a mouth rinse with fluoride. Third tip is visit your dentist regularly. Get professional teeth cleaning and regular oral exams which can help prevent problems or spot them early. Your dentist can recommend a schedule that's best for you. The fourth tip, consider dental sealants. A sealant is a protective plastic coating applied to the chewing surface of back teeth. It seals out grooves and crannies that tend to collect food, protecting tooth enamel from plaque and acid. The Centers of Disease Control and Prevention, or CDC, recommends sealants for all school-age children. Sealants may last for several years before they need to be replaced, but they need to be checked regularly. The fifth tip is drink some tap water. Most public water supplies have added fluoride, which can help reduce tooth decay significantly. If you drink only bottled water that doesn't contain fluoride, you'll miss out on fluoride's benefits. The sixth tips, avoid frequent snacking and sipping. Whenever you eat or drinking beverage other than water, you help your mouth's bacteria create acids that can destroy tooth enamel. If you snacks or drinks throughout the day, your teeth are under constant attack. Remember that. Seventh tip, eat tooth healthy foods. Okay, so which means some foods and beverages are better for your teeth than others. Avoid foods that get stuck in grooves and pits of your teeth for long periods, or brush soon after eating them. However, foods such as fresh fruits and vegetables increase saliva flow, and unsweetened coffee, tea, and sugar-free gum have washed away food particles. The eighth tips, consider fluoride treatment. Your dentist may recommend periodic fluoride treatments, especially if you aren't getting enough fluoride through fluoridated drinking water and other sources. He or she may also recommend custom trays that fit over your teeth for application for prescriptions fluoride if your risk of tooth decay is very high. Ninth tips, ask about antibacterial treatment if you're especially vulnerable to tooth decay. For example, because of medical condition, your dentist may recommend special antibacterial mouth rinse or other treatments to help cut down or harmful bacteria in your mouth. Last but not least, 10th tip is combined treatment. Chewing xylitol-based gums along with prescription fluoride and an antibacterial rinse can help reduce the risk of cavities. And that's 10 tips to prevent tooth decay for you.
Treatment. Regular checkup can identify cavities and other dental conditions before they cause troubling symptoms and lead to more serious problems. The sooner you seek care, the better your chance of reversing the early stage of tooth decay and preventing its progression. If a cavity is treated before it starts causing pain, you probably will not need extensive treatment. Treatment of cavities depend on how severe they are and how particular situation. Treatment options include fluoride treatment, fillings are also called restoration, crown, root canals, and tooth extraction. If some teeth become so severely decayed and they cannot be restored and must be removed, maybe dentists can use tooth extraction treatment.
When to see a dentist? When to see a dentist? If you experience a toothache or For mouth pain, see your dentist as soon as possible. Not only when your mouth pain or you have toothache. You, you should also visit the dentist regularly every 6 months to have your teeth checked to prevent decay or serious decay. It's also important to have regular dental checkup. Visit your dentist regularly so early tooth decay can be treated as soon as possible and the prevention of further decay can begin because tooth decay is much easier and cheaper to treat in its early stage. And don't forget to brush your teeth twice after breakfast and before you go to bed.